Now, are your partner's sleeping habits keeping you up at night? I bet a lot of you can relate to that. Over a quarter of married couples in the UK sleep apart, according to a new survey. While snoring is common, almost 2/3 of respondents say they're woken up at least once a night by their partner. A third also say they've had to stay with friends or family because of it. With Christmas a time where we like to be close to our loved ones, sleeping disorders appear to be having a significant effect on some relationships. Well, here to tell us more about tackling snoring and other sleep disturbances is Professor Bhik Kotecha, a former consultant ear, nose and throat surgeon who's been practicing for over 25 years. Now, welcome aboard. I'm sure a lot of people out there know what it's like to sleep next to a snorer, but you know, when you are one and someone shakes you and says, "Did you know you're snoring?" Frankly, you don't. What can we do about it?
So thank you very much. Snoring is very common, and more than 40 to 50% of the adults snore. And the person probably doesn't realize, sometimes they do, if they're having breath-holding episodes, they might wake up gasping for breath, but more often than not, they don't realize they're snoring and they get woken up. As a result, the sleep is fragmented both for the patient and the partner. So sleep deprivation causes a major issue. The problem with snoring is that if it is a simple snoring, it may not be a medical issue, but many patients who snore actually stop breathing, and they have a condition called obstructive sleep apnea. So they're constantly being deprived of oxygen, and if they have got sleep apnea and if that is left untreated, it can have detrimental effects to their health, like the heart and the brain are deprived of oxygen. They would have a higher incidence of developing ischemic heart disease like high blood pressure or angina. They may have a higher tendency to develop stroke or type 2 diabetes, and cognitive dysfunction like poor concentration, poor memory.
But how would you know, therefore, if you're suffering, say, sleep apnea, or you're just, an irritating snorer? At what point should you go to the GP and say, perhaps I need help?
So clinically, if the partner has noticed that there are breath-holding episodes and they've witnessed the breath-holding episodes, then they need to get some help. If the patient wakes up in the morning feeling unrefreshed, or if they have morning headaches, or they feel tired during the daytime, requiring to have a little nap in the afternoon, then that clearly indicates that the sleep is fragmented and they may have sleep apnea.
There are lots of products on the market which claim to be able to prevent snoring, from mouth guards to like plasters you can put over the bridge of your nose to various sort of unguents and ointments and nasal sprays. Do any of them actually work?
So it depends where the snoring is coming from. It could be coming from the nose or the throat or both. And it also depends on what you're using it for. Are you using it for treating the snoring, or are you using it for treating the sleep apnea? For sleep apnea, there are devices or appliances called nasal CPAP, which involves a mask on your face, or an oral appliance called a mandibular advancement device. The problem with these devices is that you got to use it during your sleep and every night. So obviously the compliance is not very good. But there are newer devices. There's a recent innovation of a device called eXciteOSA. And this device is quite innovative in that it produces neuromuscular stimulation of the tongue. And by doing so, it increases the muscle tone of the tongue so it doesn't drop back. But the beauty of this device is that you do not have to use it during sleep. You use it for 20 minutes before you go to bed. So it strengthens the tongue muscles. And you use it continuously for 6 weeks every day. And it'll keep your tongue nicely toned so it doesn't drop back into your throat and collapse. The throat doesn't collapse.
Now, in terms of those people who don't have sleep apnea but are partial to the odd snort or two, I know I've been accused of it in times past, what brings that on and how can we try and reduce it? I mean, do things like reducing consumption of alcohol or the position in which you sleep have an effect? Or is it just a case of saying to the person sharing your bed, here you go, here's some earplugs?
Yeah, so alcohol increases the problem because it has an impact on the muscle tone. So it makes the tongue drop more than what it normally would. If a patient is obese or if they've put on weight, weight loss can also help. Snoring is usually worse on your back as the tongue drops back on your back. So all those things can be adjusted, and it might have an improvement on the snoring itself.
And in terms of other things that, like I said, over-the-counter medicines, if people are a snorer or their partners tell them that they are there other things that we can buy that might be able to help?
So yes, if people have nasal congestion secondary to hay fever or allergies, you can get nasal steroid sprays that you can buy over the counter. Some of them you can. You can buy antihistamines, and that will help you breathe better through the nose, and that might help. And as I mentioned earlier on, the oral appliance like a mandibular device might help. And this has to be inserted in your mouth at night time and have to keep it in during sleep. But other than that, some patients may benefit from surgical intervention. If they've got large tonsils or if they've got nasal polyps or deviated septum, then they may benefit from surgery. But these patients have to be carefully selected for the procedure.
And how many people do you think that would cover? I mean, if people are aware that they're a snorer, should they all be going to their GP to have it checked out, to go to, say, a sleep clinic to find out what is behind the late night rumbles? Or would that just be instilling fear in a population when so many people do apparently snore?
So if you look at the whole snoring population, about 10 to 15% of these would have a problem with sleep apnea. And the best way to judge this is through the clinical symptoms. Like if they feel that they haven't slept very well, they wake up in the morning feeling unrefreshed, or if they've got morning headaches, or they have daytime tiredness, then they certainly should see the GP and have a sleep study arranged so that we can identify whether they have or have not got sleep apnea.
I hope you've actually helped to bring a little peace and quiet to some people's relationships out there over Christmas. We all know what it's like to either sleep next or down the corridor from a snorer, don't we? Oh, yeah.